My name is Catherine Kwame, and this is my presentation entitled Maintaining the Line of Defense, Betty Neuman's Systems Model of Nursing. This is my theorist, Betty Neuman, and again, her theory is the Neuman Systems Model of Nursing. We will get into her model, but first let's start with a biography of Betty Neuman. She was born September 11, 1924, and as of this recording, she is still alive, aged 96. I personally think that is very exciting because when I think of theorists, I think of people who have been dead for a long time and their theories are maybe a little out of date, but it's nice that someone is still alive, and it just makes me wonder, could one of us be the next great nursing theorist? Who knows? Now, Neuman has both a BSN and an MSN from UCLA, double majoring in mental health and public health. She also has a PhD and a couple of honorary doctorates. She's very well educated and well respected in her field. She did help develop the mental health nursing program at UCLA, and she published her first of many books in 1982. This first one was called The Neuman Systems Model, Application to Nursing Education and Practice. This is a diagram that Neuman created to help explain her system model. Now I'll let you take out your magnifying glass and look at it more closely later, but I just wanted you to have a visual image of what we're going to be talking about in more depth in the following slides. Now, the core ideas for the Neuman system model is that we all in our core have energy. This is our temperature, our genetics, how our organs function, and then illness for Neuman is when there's an excess energy usage, which leads to an imbalance in the body. Now, to help prevent illness, there are lines of defense. So our normal line of defense is the typical level of health for the individual. This changes over time based on someone's coping and how they respond to their environment. Now, this is very individualized. Let's say a person with COPD is brought to the emergency department, and when they're hooked up to the monitors, they're satting at 90%. Well, that's probably pretty normal for them. But let's now say that a 3-year-old is brought to the ED and is satting at 90%. Well, it is very likely that that is not normal for the 3-year-old, and they're going to need some pretty serious interventions to bring that oxygen level up into their body. Now, the next line of defense is called the flexible line of defense, and these are protective mechanisms that come into play during times of stress. They act as protective buffers to prevent these stressors from invading the body. Some examples of these are social support, a person's individual resilience, and their age, their spiritual well-being. A lot of the nursing process is to help bolster these flexible lines of defense. And some, obviously, like age, you can't do anything about, but some, like resilience or spiritual well-being, can be improved. Someone could take up yoga, meditation, prayer. They could find a support group to help bolster their social support. And so we want to help create these strong lines of defense for individuals so that when during times of stress, they're able to prevent illness. Now, stressors for Neuman, intra, extra, or interpersonal factors. So intra, from within, extra, coming from the environment, or inter, between people. All of these can have a negative impact and try and break through these lines of defense. Now, in this model, the results are a successful defense is equal to reconstitution of health. So this could be at a higher level from their baseline. So let's say a patient comes in with acute pancreatitis and they recover from this illness, and then they're like, gosh, that was pretty terrible. I really don't want to experience that again. And so they decide to quit smoking and quit drinking and exercise and eat well. Now, they're going to be in a healthier state than they were before they had this acute illness. Someone could also be returned to their previous level. They could recover from their illness and just go back to their status quo. Or they could be at a lower level of health after their illness. Let's say someone has a stroke, they survive the stroke, but now they have some pretty serious deficits. They have, let's say, right-sided weakness, and they have various degrees of aphasia. They're going to be at a lower level in their normal line of defense and well-being than they were before they got ill. And for Neuman, unsuccessful defense, the body cannot restore balance, well, that's going to end in death. Now, for Neuman, prevention is really, really important. And as most people have talked about in other nursing classes, there are 3 different levels of prevention. First, we have primary prevention, and so this is reducing stressors, strengthening that flexible line of defense. So some examples: healthy diet, regular exercise, adequate sleep, yoga, quit smoking. So you're in your state of wellness, you want to stay there. Here are some things you can do to prevent getting sick. Secondary prevention. Now this is early recognition of stressors. It is symptom management. So someone is sick, and so we're going to try and prevent complications. This also could be health screenings for at-risk populations. It could be HIV screenings for people who regularly use intravenous drugs, for example. It could also be lifestyle modifications. So if someone's diagnosed with prediabetes, well, they can make some pretty serious life changes to prevent full-blown diabetes. That would be secondary prevention. Tertiary prevention is education to prevent complications and reoccurrences. And so the person has been ill and they have recovered. Now, whether they went back to their norm baseline or if they now have a new lower baseline, these tertiary preventions are going to try and mitigate and help people adapt to their new state of being. So it could be like support groups for cancer survivors, for example. Now, the Neuman systems model is used in a lot of nursing studies, I have found. This is just a brief, short list of studies that I found, and you can see they're pretty across the board. So we have support for vulnerable children, general psychosocial care, care for patients with schizophrenia, dementia, military to civilian reintegration, management of pressure injuries following a stroke, and stillbirth and SIDS. Some ideas that I had for using the Neuman systems model for various nursing interventions are the following. You could offer gender-affirming cancer screenings for non-binary individuals, health and wellness fairs for underserved populations, healthy food options at schools and daycares, could offer cooking classes for kids and families focusing on healthy, affordable, time-efficient meals, low-cost exercise programs, support groups, and I just put insert malady here because you can have a support group for anything because everybody is going to benefit from meeting with people who are in a similar state as they are. You could organize letter writing or phone call groups to support isolated individuals and do careful assessment for self-harm and suicide for vulnerable individuals. In conclusion, here are just a brief overview of what we've talked about. The client has a normal line of defense, which is their baseline state of wellness, and that is going to vary from individual to individual. Now, in times of stress, the client's flexible line of defense, their resilience, their support, is going to activate to help prevent illness. The role of the nurse in all of this is the following: to help maintain balance and prevent illness, to restore balance in a state of illness, and to reintegrate the client after an illness. Here's a couple of questions for discussion. Think of a patient you recently cared for. What interventions could you have performed to improve their flexible line of defense? Were they in need of primary, secondary, or tertiary prevention measures? Explain your reasons. And 2, what is a primary prevention need you have noticed in your community? What nursing interventions might you employ to help meet this need? And these are my references. Thank you so much.